Welcome to the Esteemed Life Network with Ajiboye Bolale. This is a platform where we connect, we learn, and we grow together. If you're just joining us for the first time, you are in the right place. Come on in. Let's roll together, let's learn, and let's keep growing. For all our subscribers, we say thank you. We appreciate your support. And for all our friends out there that are yet to subscribe, please subscribe. Let's grow together. It will always get better. So welcome. Today we're talking about a very interesting topic in the field of mental health, and that is depression. Depression is a common mental disorder and it affects people differently. Depression has been classified to be a form of mood disorder, and it can be described with a feeling of sadness, hopelessness, fatigue, loss of interest that affects day-to-day activities. Different people experience depression differently. It can interfere with productivity at work. Depression can interfere with forming meaningful relationships. Depression can also influence medical conditions. However, it is important for us to realize that when we feel sad sometimes, when we feel low, when we have this low mood and we feel tired, it doesn't necessarily mean we are depressed. But when the feeling of hopelessness, the low mood, the sadness becomes consistent, that is when we need to seek help, because that may be pointing to depression. And so there are different symptoms of depression I'll be sharing with us all today. And I want us to be aware about all these symptoms and to know the best step to take moving forward. Depression affects men, women, children in different ways. It can affect our mood, it can affect the body. And these symptoms varies. Some of the general symptoms of depression are irritability, hopelessness, consistent fatigue, lack of interest in those things that usually gives you pleasure, like sports, like exercise, gaming, your hobbies. You just lose that interest. Again, some of the other symptoms may be insomnia, that is lack of sleep, or even excessive sleeping, lack of concentration, cognitive inability. There is also the loss of sexual drive or lack of sexual performance. There is a thought of suicide associated with depression. There is the chronic medical condition, chronic pain. There is also a situation that we call the attention deficit hyperactivity disorder. Some of these symptoms of depression could also be hopelessness. It could be social withdrawal, that withdrawal from social interaction. It could also be loss of appetite and so many other symptoms. All these symptoms should be taken note of. However, depression can be caused by different things. It could be as a result of family history. You are at risk if someone in your family or some individuals in your family have had the issue with depression in the past. There is this high risk also if you have experienced childhood trauma. There is a greater risk if you have chronic medical conditions. Also, the structure of the brain. The frontal lobe of the brain needs to be active. If this is not active, there is a risk that depression can set in. However, Some other risk factors associated with depression could be loss of self-esteem or low self-esteem. It could be the stressors of life, from events related to loss of your loved ones. It could be as a result of divorce, economic problem, and so many other things that happens and that can stress us out and lead to depression. Also, the use or misuse of drug and alcohol. This can be a cause of depression, or it can be a causal effect of depression. So what are we going to do? When we begin to notice all these symptoms or some of the symptoms I mentioned, we need to seek medical attention. Do not overlook the symptoms. If you leave the situation untreated, the condition gets worse. And depression, as I said, is a very serious issue. It starts from mild and then gets to the extreme. There are different types of depression, but we're not going in there today. I just want to create the awareness around the symptoms of depression and the causes, just like I listed out. The family history, childhood trauma. Depression could be, as a result of even the personal mental illness experiences that you've had. So seek help when you begin to notice all the symptoms of depression that I talked about. And there are some things we can actually do, like alternative treatment for depression. Aside medication, aside therapy, aside all those things that our medical or our professional experts or therapists would do. There are some things I just want to also create an awareness around today. And those are little things that we can actually do for ourselves. Exercise. Exercise is very, very, very important. At least 30 minutes of exercise 3 to 5 days in a week can help put us in a very good mood, because exercise secretes or produces endorphins. It helps us to produce endorphins in our body. These are happy hormones, and exercising is a way to keep fit. Avoid the use of alcohol and the misuse of drugs. Again, we can also consider sleeping. Yes, taking care of yourself, self-care practice, having at least 7.5 hours of sleep in a day. Most of us, we are so stressed, and so we are overwhelmed. And being overwhelmed can add to our symptoms of anxiety and depression. In the areas of boundaries, learn to say no. When we don't say no, people step beyond our boundaries, and this can also overwhelm us. So we need to set healthy boundaries for our personal lives and our professional lives. This will also help us, to take care of our mental health and to avoid some of the symptoms of depression. In a situation whereby you are having suicidal thoughts, do not keep it to yourself. Please seek help. It is very, very good for us to pay attention to our mental health. It starts from little symptoms. And from those little symptoms, it builds and it becomes very, very serious. So we don't want to wait to that extent where it becomes extreme. No. When we begin to notice those symptoms like hopelessness, loss of interest in everything, lack of productivity, lack of appetite, reduced sexual desire, and even lack of sexual performance, or loss of interest in those things that usually gives you pleasure, please seek help and pay attention to your health or to your health. Depression is real. Depression is common. Depression happens, and a lot of people experience it. And I want to say to everyone that is depressed out there, you are not alone. You are not alone. Please seek professional help for your depression and be positive. Adopt, some of those alternative treatment therapy that I gave. Therapies related to exercise, to resting, and helping yourself when you feel there is a burnout. Help yourself. Pay attention to your emotions. And please, your mental health, your physical health, your emotional regulation is very, very important. Take care of yourself. I love you all.